Covenant Healthcare is extraordinary thanks to donations of time and money from our employees and the community. Through fundraisers like the Red Carpet and the Covenant Kids Telethon, as well as annual giving donations, memorials, and other gifts, more than $1 million each year is put towards improvements to technology and programs at the medical center. Scholarships have been shared with college students who will be our caregivers in the future, and state-of-the-art technology is now possible to diagnose tumors deep within the lung without ever making an incision. Covenant doctors say this system is a huge leap forward from other exams, which grew more complicated if the tumor was deep inside the lung. Now V-pads with electromagnetic sensors are placed on the chest to guide the probe and track the patient's breathing. A computer calculates the shortest path through a web of branches in the airway.
Right when we start off, we go through the airways and we intubate, kind of go into each airway. And what that does is it draws little plots in space. And when it gets enough plots, the machine is smart enough to say, all right, I know where these plots are going.
It gives us a lot of details when we go through this procedure. With the navigation, it tells you exactly where you're going and if you hit the lesion, yes or no. So it's a big help with that.
Older methods needed to do the exam in multiple visits. Now it's over in minutes with much less risk.
Patient comes in the morning and after the procedure, within 1 hour or 2 hours, they go home. Majority of the cases, it takes within 2 hours, I believe.
A $250,000 donation from the Covenant Healthcare Foundation made this life-saving diagnostic tool possible, and doctors believe the system will soon provide cancer treatment as well.
In the future, this technology may be used in actually treating early-stage diseases, which would forego the need for surgery or radiation. But the future looks bright. I think them reaching out in the community and then finding that support just shows what kind of a great community we are. Hopefully we can give back to that community. Hopefully Super D can provide that kind of a gift back to them.
Your donations are also improving the safety of our patients, especially those who need assistance getting out of bed. Rehabilitation patients require special help getting around, and it's easy to forget this when you start feeling better. These cameras are now watching out for fall risks, monitored by nursing aides from this room. If someone starts to get out of bed, they'll see it and respond in seconds.
Is there something I can help you with? There are different ways that we can respond to them. We can talk to them with our own voice, or there are pre-recorded things that we can say, attention, do not get up. Or if we have someone undoing their seatbelt, we can say, please do not touch that. And in the meantime, we can, get a hold of their aide or a nurse to intervene to verbally redirect in person also.
Attention, please do not get up. Some
patients respond better to the stern voice of the pre-recorded. I personally like to talk to the patient. And a lot of times, we know what their names are. So if we say their name, it is a little bit more personal with them, and they do respond well to that.
Atención, por favor, no se levante.
The monitors can also respond in different languages, even Mandarin Chinese.
好的，我将会吩咐一位医护人员去您的房间。
Some patients worry about constant monitoring, but privacy is maintained, and the decrease in falls certainly shows this technology is worthwhile.
We just reassure them that, we are watching more than one person, but we are still watching out for their safety, and we are there to benefit them. I believe in this program wholeheartedly. I train people on it. I'm back there a lot because I believe in it, and I want our patients to be safe, and I think this is a great step forward in making our patients safe and providing that safe environment for them, and their families can go home knowing that we're taking care of them, not even just with our hourly rounding, but just, 24 hours a day, we're watching them and we're there for them.
A dozen cameras are now helping rehab patients, and another 18 are being used in acute care, all thanks to your donations to the Covenant Healthcare Foundation.
Thank you so much. This program is amazing, and thank you so much for helping us provide a safe environment for our patients.
Foundation monies are also found in this special cart, which provides immeasurable comfort when a family doesn't want to leave the bedside of a loved one who is in their final stages of life.
So the family doesn't have to do anything. The nurse will handle everything. We'll make sure that order is placed and the cart is delivered. And again, it provides just basic. It's not a meal. It's just some light food and some beverage to sustain the family so they don't have to leave the hospital room of their loved one.
From comfort carts to diagnostic tools, not everything can be squeezed into a hospital budget. That's where you can help. Remember the Covenant Healthcare Foundation during our annual giving campaigns, the telethon and red carpet events, and think of how you can help in a life bequest. Learn more at www.covenanthealthcare.com and click on Giving.